process of reporting sexual assault. We stand today on the site of our soon-to-be renovated flagship campus. The campus will be a disclosed location in an effort to bring sexual assault and domestic violence survivors out of the shadows to make sure they know where they can receive services. Hawk is leading the team that is working to modernize sexual assault response in Houston and Harris County. And today we are also releasing our own Hawk Sexual Assault Report. We pulled together our organizational knowledge we've gathered over decades of working directly with survivors and advocating for their rights. I want to acknowledge that the simple fact of having so many distinguished elected and public officials here today is a victory in and of itself. Sexual assault can be difficult to talk about and is surrounded with shame and blame, and just to have this group of people here genuinely committed to working together on behalf of survivors, I declare victory. The number of sexual assaults in Harris County is extremely high. 4,000 almost were reported in 2021. And the thing is, that doesn't even begin to capture the actual number of sexual assaults in Harris County. Data shows us that less than 10% of sexual assaults are actually ever reported. Often the survivor is so overwhelmed from processing this traumatic event that the idea of going through the complex process of reporting an assault can be unimaginable. Or they think it won't matter if they do report it, that no one will believe them, and that there's nothing that can be done to hold the perpetrator accountable anyways. This is a huge problem because it means perpetrators are still out, potentially assaulting other people. Sexual assault survivors must feel supported and believed by the systems that are in place to protect them and to hold the offender accountable. 8 out of 10 times, data shows, a sexual assault is committed by someone the survivor knows. This is the only crime where a victim's character and credibility are called into question. This can make a survivor feel like they are not being believed, like they are the ones on trial, not the person who assaulted them. I think we can all agree this needs to be changed. The bottom line is sexual assaults are not being reported, less are being investigated, and exponentially less are being prosecuted. We need survivors to know their case matters, their investigation matters, their healing matters. We must do better, and I am so proud that Hawk is the presiding officer of the Sexual Assault Response Team because we are together going to do better. And with that, it is my distinct honor to introduce Sonia Corrales, Deputy CEO of the Houston Area Women's Center and the real leading force for the Sexual Assault Response Team.
All right.
Oops. Good morning, everyone, and thank you, Emily, for always striving and always keeping our survivors and centering their voices. We're here to talk, obviously, about sexual assault, but we also want to highlight the sexual assault response team, the Harris County Sexual Assault Response Team. I want to start by thanking our Precinct 2 Commissioner, Adrian Garcia, for really leading the charge in establishing the Harris County Sexual Assault Response Team and for making sure that Harris County fulfilled the requirements of SB 476. I want to also give a special thank you to Dr. Veronica James. She's with the Research and Analysis Division of the Office of the County Administration for the county, and she has been very instrumental in the Harris County SART, and even though she didn't have to, she was invited to the meetings and came to every single one of them. Thank you very much, Veronica. Right. I want to thank TASA, the Texas Association Against Sexual Assault. Where's my sister Rose?
Over here, next to here.
Ah, there she is. For their relentless fight on behalf of survivors, and for also for allowing us to use all of the tools that you provided and just your guidance in this process. Thank you very much. As Emily said, you know, we were elected presiding officer. The Houston Area Women's Center was of the Harris County SART, and I had the honor of leading the team. But of course, this work that we do here is not and should not be done alone. Standing alongside me are the core members of the Harris County. We're having some technical difficulties, that's okay. The core members of the Harris County Sexual Assault Response Team that include government agencies, non-government agencies, and represent various disciplines, including rape crisis advocates, systems-based advocates, medical forensic nurses, law enforcement, the district attorney's office, mental health providers, and community organizations. This is a SART. And if you are on the SART and are still out there, you can come back over here, please. So one of the recommendations as part of the report is that we want to make sure that we engage all of the partners, and we continue to add partners. So one of the recommendations is to continue to add partners. While this is the SART today, it can grow and likely will grow in the future. The vision of the SART is to create a safe, equitable, and violence-free society where all lives are valued and respected. And the mission of the Harris County SART is to provide a multidisciplinary, collaborative response to all survivors of sexual assault that is individualized, trauma-informed, increases safety, promotes continuity of care, supports and empowers survivors while holding offenders accountable in a fair and just system. The team successfully submitted their first report that was required by legislation. It was submitted to the Harris County Commissioner's Court just yesterday, actually, and it includes protocols or agreements between all of these agencies about the provision of services that are very specific to sexual assault survivors and each one of our roles and responsibilities of each of the members. It also includes the state of sexual violence in our community and our region. So you will find, some statistics that were provided by each one of the members. The report also includes a set of recommendations that will guide the team in our efforts in implementing and expanding this trauma-informed, victim healing-centered policies and practices. Now, we've made lots and lots of strides in raising awareness on sexual assault. We've created lots of changes in laws. We've increased efforts of rape crisis centers. College campuses now require sexual assault information be included as part of the orientation. We have specialized units in law enforcement and prosecution offices. We've included systems-based advocacy, and we've made lots of advances in the medical forensic exams. But yet, we still have a culture that blames survivors and struggles to hold people who commit sexual assault accountable. So the reality is, as Emily indicated, is that a lot of the case outcomes for sexual assault are not great. In fact, they're poor. Many survivors do not seek either services in the community and oftentimes don't navigate that criminal justice system because perhaps they're not aware of services. They fear that the system will not be helpful, or somehow it might be harmful to their well-being, and they may not be believed. That's one of the biggest ones, is that survivors feel that they're not going to be believed as they access these systems. That is why we are here. That is why the SART has been established. But it has not only been established in just an informal way, it really is a formal way of coming together and providing this awesome opportunity to hold each other accountable for the work that we said that we were going to do, and then to be held accountable by the Harris County Commissioner's Court. Now, one of the recommendations is to make sure that we improve access to the community-based advocates. So that's one of the things that we found. Time and time again, what we hear from survivors is that they want an advocate, and we want to make sure we want to make sure that that occurs. Another recommendation is that while we are collaborative and we have long-standing relationships with one another, that we felt short in the way that we collaborate with one another. So the recommendation is that we establish this framework on how we use our results, because these protocols are a living document, and we want to make sure that we include these survivor voices, and that we're continuously evaluating the work that we are doing. Another recommendation was that using and really looking at the way that we're doing this work collectively through this systems-based approach. And what we mean by that is that we want to make sure that we are looking deep into the policies and procedures and practices of each one of our organizations. And if we need to make changes, then we should make those changes, but collectively, because we cannot do this work alone. There's no one agency. Another recommendation is to include these voices, or strengthen the voices and inclusion of survivors. And our goal is to implement a protocol that includes an avenue to include these voices, either by survivors sitting at the table or through surveys or in some way that we really are getting the feedback, because only then will we really know how they experience us as service providers in the community, and also criminal justice people. So I am incredibly grateful that we have two survivors here today who will lend their voices and experiences to the mission of this SART. Survivors, as we know firsthand how to access services, what has happened when they access services, what has happened as they navigate these systems, and just their experiences. So we want to make sure that we listen to survivors. So I want to take this opportunity to introduce Marlicia, who is a HAWK client and also a survivor of sexual assault, and she's going to share her experience with us today. Marlicia.
I believe I'm good. Good morning. My name is Marlicia Price, and I'm a survivor and also a client here at HAWK. I want to start by saying, in 2022, about 2.13 million people aged 12 and older in the U.S. were victims of assault. That number is a mere fraction of the true number of victims throughout the U.S., as sexual assault historically is underreported. Sadly enough, I believe it's safe to conclude that a large number of the U.S. has been or is likely to become a victim in the future. I am speaking from personal experience when I say walking the justice system in its current state is like walking nude and exposed down a long hallway paved in thorn bushes. Victims are frequently told to move on with your life and to stand still emotionally at the same time while waiting years to be heard by the criminal justice system. There were times in this process where I felt belittled, discouraged, and treated like a nuisance to a system that is founded on the concept that crimes against a victim or an individual is a crime against the state, and these crimes victimize all of society. Less than 60 people were convicted of sexual assault charges in 2022 by the Harris County District Attorney's Office. 631 reports of sexual assault in 2023, but fewer than half will have charges filed. Can we agree that people committing these assaults should be reported and named and held accountable for their actions? Victims courageous enough to show their commitment to their community by reporting dangerous people should not be met with judgment or flawed practices. They should find a system that is compassionate, standardized, and with modern laws. Policies and practices should be both just and victim-centered. It may be challenging for some to understand how difficult it is to be traumatized, distracted, but to have to answer a multitude of intimate questions and make complex decisions without being properly informed. Did you know that there are different types of physical exams, and each examination can impact the evidence needed to prosecute a crime? I did not. Did you know that there's an advocate that can stand by your side at the hospital and advise on each step of this examination? I did not. Did you know advocates could assist victims with a safety plan right when they first report a crime? I did not. It's often so overwhelming that moving forward with the process is difficult to endure. Those who specialize in victim-centered care must be truly trauma-informed and understand the many ways that victims process trauma. To be present with the victim and to have the victim's best interest at the forefront. There's a desperate need for trained support in Harris County, as well as the neighboring counties that communicate with each other. And a need for agencies and nonprofits to work together to provide that wraparound support and communication, as stated in Senate Bill 476. Some might say that the judicial system doesn't have the money, legislative backing, or workforce to support a system inclusive of a victim-centered approach to justice. I ask, why not? When there's an expectation of citizens to uphold their civic duties, why shouldn't the citizens expect the system to do the same? No one should ever hear that their case will not be prosecuted because of the mishandling of evidence. No one should ever feel like they're being blamed for what has happened to them. Reporting a crime should never lead to more trauma. But unfortunately, that's what reporting a sexual assault has been for so many. We need each of these agencies to work together to ensure proper evidence collection, storage, and processing promptly. We need nonprofit programs to support and send their advocates to join survivors at the hospital or through the criminal justice process. We need these programs funded so every call for help is answered. I want to encourage people to report crimes, but the system intended to hold offenders accountable must do what's right and just, not just what's easy. People should report crimes, but we cannot expect them to when the system is obviously not working, when the process is not respectful, and when survivors do not know how to navigate each step. Victimization is increasing. When the system no longer meets the needs of its people, it is time to elevate and reform with laws, policies, and practices to serve the people it is designated to serve. Survivors of sexual assault deserve better. Our communities deserve better. Thank you.
All right.
Thank you so much, Marlicia. We really appreciate your powerful testimony. I'd like to invite Commissioner Garcia up.
Thank you. I guess that ain't gonna work. Marlicia, I just wanted to say we got your back, girl. We got your back. To all the survivors, we got your back. And I just am so proud to be here today. I'll just leave that alone. Proud to see that we're here to celebrate the creation of this team, and I'm proud to have led on this effort. When the opportunity came to ensure that we can do better at bringing organizations together to do their jobs better, that was all too commonsensical for me. We've done it with homelessness, and we've identified that eliminating the silos provides better results. The report is worrisome in some regards, but there's nothing here that we don't already know. This is why I felt it was important to do this, to ensure we're doing something to address the gaps and take steps to address them. You know, Marlicia's points ought to just sting every one of us that have a responsibility with making these systems work better. Her remarks of being made a victim yet over again and again is unconscionable for any one of us that hold any one of the reins of the justice that she is expected to receive. But despite the alarming data results, it's important to highlight what this means. As Sonia has already laid out, achieving streamlined methods of reporting will provide that survivors are not having to recount their stories over and over and over again, reliving the horrors of what they've experienced. Key players in the systems that support survivors of sexual assault that weren't previously communicating are now coordinating care and recovery and working to improve systems and hold abusers accountable. We now know the full nature of the crisis with the local data. Before SART, we would not be able to quantify this data because previously there was no consistency in the way the data was collected, making it harder for cases to move forward. With this, we are able to have a collective response in eliminating the gaps and better define the roles that every one of us has. As a result, this helps us create better protocols and improve systems specific to the needs of survivors. This is important because we know sexual assault is an extremely traumatic and horrific experience with both short and long-term effects. So it's important that we are thoughtful and intentional on the ways we provide continuity of care and support to these survivors. As the largest county in Texas and the third largest in the nation, it's important for Harris County to lead and set a positive example. We know other municipalities are taking notice of how this group is setting the standard and hoping to replicate what we're doing. And let me just say, a lot of this work would not be possible if not for the leadership of Hawk. Emily, thank you, but in particular to Sonia Corrales for her respective and personal leadership as well. And we also need some really smart people. And so I just can't emphasize the value that Dr. Veronica James has brought to the process. She's immensely shy, so give her some love. And so I am just so grateful for everyone's commitment to really show that we're here to do better. This report is a starting point for all of us to ensure that we now have a blueprint of where we can make the systems really talk to each other, work together, but ultimately ensure that the survivors have a system that has their backs. And to the entire SART team, for their time, expertise, and forward thinking and approach to addressing this public health crisis impacting 6.3 million women and men. Now I'd like to say a few words in Spanish, if you allow me. Primeramente me da mucho orgullo de estar aquí, celebrando que estamos mostrando el impacto de este equipo. Me da mucho orgullo que yo fui el líder en llegar a desarrollar este programa. Estamos reconociendo la importancia de tener las organizaciones que trabajan dentro del sistema de justicia y dentro el trabajo de apoyar los sobrevivientes de los asaltos sexuales. Es importante demostrar que este reporte nos está enseñando mucho. Obviamente nos está diciendo que nos falta mucho trabajo, pero a la misma vez este reporte no nos debe dar temor porque nos va a dar la oportunidad de hacer las cosas mejor y últimamente tener más respaldo para los sobrevivientes mientras que están pasando por el sistema de justicia. Queremos reconocer que este reporte nos ayuda a entender dónde hay faltas, dónde hay áreas donde tenemos que traerle atención, recursos y participación y colaboración dentro de las diferentes organizaciones. Este reporte nos está enseñando que cuando estamos coordinando los sistemas de reportar, eso les ayuda a las víctimas a no tener que hablar de la trauma, del ataque que ellos sufrieron. Antes de este reporte reconocimos o no subimos que las víctimas tienen que hablar de sus experiencias, de toda esta trauma, cada vez y con cada diferente persona con quien ellos estaban teniendo contacto. Esto nos está ayudando a entender que podemos y estamos eliminando esa otra trauma que le estamos trayendo a las víctimas. También nos ayuda a saber que tenemos que mejorar los sistemas de comunicación dentro de las agencias para asegurar que el cuidado, el tratamiento, el apoyo que las víctimas merecen, que se lo estamos trayendo y lo estamos trayendo en un modo mucho más saludable y con mucho más cariño por las experiencias que ellos han sufrido. Entonces, antes de este grupo del de SART, no pudimos entender la información porque la información no estaba colectándose en un modo en un modo estándar a través de todas las diferentes agencias. Ahora lo vamos a hacer. También nos ayudó a entender, como mencioné, dónde nos faltaba trabajo dentro de las diferentes agencias y llegar a definir qué papel cada organización merece tener. Y también nos está ayudando a entender todos los protocolos que debemos de tener y cómo mejorar los sistemas para asegurar las necesidades de los sobrevivientes. Todo es importante para hacer y entender, porque es importante de reconocer que un asalto sexual es una experiencia traumática, es una experiencia horrible, y debemos de decirle a todas las víctimas, a todos los sobrevivientes, que nosotros las vamos a respaldar. Entonces, reconociendo que somos el condado más grande en Texas, el tercer más grande de los Estados Unidos, es importante demostrar que el condado Harris está mostrando un ejemplo positivo de cómo podemos trabajar juntos. Y otros municipios ahora están tomando atención de todo lo que estamos haciendo y quieren seguir con nuestro ejemplo. Últimamente, quiero terminar para decirle que a la agencia del Houston Area Women's Center, gracias por el liderazgo, a la directora, a la jefa, Emily Whitehurst, pero a la segunda jefa, Sonia Corrales, por su gran trabajo en mostrando que podemos hacer mejor, y lo estamos haciendo. Gracias.
Good morning. I'm Harris County Sheriff Ed Gonzalez, and before I get started with my formal remarks, I just want to once again just commend the Houston Area Women's Center. It's incredible to be here. I remember visiting the initial footprint here, and it's incredible to see how far it's expanded, to see construction moving along, and the many persons that will be served by their expansion. And so a personal plug for Hawk. Anytime they call, we're there. We want to be a part of anything that they're doing. We want to be supportive of their work. We want to collaborate with them. We want to support them. We've assisted financially when we can. We collaborate as well with our membership, supporting their efforts and providing information and data where we can. But really want to commend Emily Whitehurst and her leadership. Of course, Sonia Corrales, the remarkable Sonia Corrales. I know the board chair is here as well, Jessica. Thank you for all your efforts, the entire board, everybody that makes Hawk such a wonderful agency. We're so fortunate, and sometimes we may take it for granted that they're here locally, and they're just second to none. And their work around domestic violence, prevention and awareness is obviously noteworthy and very well known, but sometimes we forget there are many efforts centered around sexual assault, so it's important to be reminded of that. Did you know that last year alone they fielded more than 6,000 calls through their hotline? They provided over 300 visits where they accompanied someone to the hospital to make sure they were not alone. They provided resources and services, or connected people to resources and services, over 9,000 times. That's impressive. That's impressive. And so it's important to recognize that incredible work. And so today, once again, we also thank them for hosting this news conference to raise awareness about sexual assault and to advocate for every person's right to feel safe. And today is an important milestone because, as Commissioner Garcia mentioned, this is a first step. We cannot tackle something that we're not fully aware of. And if there's been gaps in the responses in the continuum of care, then we want to know about it. Whenever something isn't working and we find out about it, I say good, because now we could do something about it. And now we can make sure that we're tackling head on, not running from it, not hiding from it, but tackling head on. And I know that collectively we can make a difference. So Commissioner Garcia, thank you as well for leading the effort to make sure that we do get this report and make sure that it's going to be presented to Commissioner's Court, because we all can do better. We all have individual and collective responsibility to do better. And at the Harris County Sheriff's Office and our partners here, we firmly stand with advocates, sexual assault survivors, and their loved ones, providing them with unwavering support. Our agency, the Harris County Sheriff's Office, is a part of SART, the Harris County Sexual Assault Response Team, to enhance our collective efforts in responding to and preventing sexual abuse in the community. And I want to recognize some of our members that are part of that team. I know Lieutenant Klafka's here, Sergeant Smith, and some of our other investigators are here today. So thank you for being in the front lines of our response and our work. The sexual assault, we're here because we want to expand more social awareness about sexual assault. We want to make sure that we respond to sexual assault by fighting against it, helping its survivors, educating about it, and striving to prevent it. We need a greater understanding of the prevalency of sexual assault. And even though the numbers are high, we know, as Emily pointed out, that even then it's underreported. So there's so much more that's happening in the community. The trauma it causes, not only short-term, but sometimes long-term, the financial impacts to the survivors. We can't forget that. And we also need to make sure that we are there to assist all survivors. But no, they're not just victims, they're survivors. They've been wronged, and they need our help and deserve justice. And we need to make sure that we're all working collaboratively to tear down any barriers, any limitations within an entire criminal justice system. It's not just one part of the system, we're an entire system. And we all have to make sure we're looking introspectively to make sure that we're improving our own operations to be more effective, that we're putting adequate resources and making sure the right protocols are in place. The SART team, the Sexual Assault Response Team, is there to enhance our collective efforts in responding to and preventing sexual assault, as I mentioned, within our community. And the team is a collaboration, and I want to emphasize collaboration because that's what it is. We're joined with our law enforcement partners here, with my friend and team member, Chief Finner, his agency, his remarkable agency, to bring law enforcement together, medical professionals, advocates, and other key stakeholders to provide comprehensive support to survivors of sexual assault. But in the end, it's not about any one of us. It's about Marlisha. It's about making sure we're being victim-centered and remember our why, not forgetting our why, that we're here for those that have been wrong, for those that have to endure this. We have to make sure, look, we all operate within a bureaucracy, but as leaders, it's up to us to make sure the bureaucracy is working for the people that have been wrong, for the survivors out there, for their families. So we got to make sure that we stand united and that we stand strong and that we're doing our best efforts to raise our individual game and our collective game. So briefly in Spanish, wanted to say que estamos aquí esta mañana para revelar este reporte que se inició. Le quiero agradecer al comisionador García por su liderazgo, por realmente unir este colaborativo. En tiempos pasados nosotros trabajamos siempre en estos casos, pero individuales con nuestras agencias, pero él pudo unir a todas las personas que están ahí para apoyar a las personas que han sido víctimas. Está ahí para unir las agencias policíacas, las agencias que ayudan y apoyan a las víctimas. Entonces es muy importante realmente entender cuál es nuestra respuesta, y la respuesta en conjunto, la colaboración es sumamente importante para estar seguro que las víctimas que no sigan teniendo ese trauma de un proceso que es muy largo, que se lleva mucho tiempo para terminar, y también traerle justicia para ellos. Entonces estamos muy interesados de ver cuáles son lo que se aprendió de este reporte inicial, para todos mejorar nuestros esfuerzos para apoyar a las víctimas, a sus familiares. Y también esto es muy necesario en nuestra comunidad, porque esto pasa mucho, y también para nuestra comunidad de habla hispana. Yo sé que muchas veces hay temor de presentarse porque temen tal vez el sistema, no entienden el sistema. A veces hay temores del sistema migratorio. Nada de eso lo debe de prevenir de que usted pueda reportar su caso, que dé información y que nos ayude a capturar esas personas que sean culpables para traerlos a justicia. And again, just in closing, it's an honor to join all these incredible leaders. Look forward to seeing the report and making sure that we're working very closely, again, to raise our game. We could each do better. We need to make sure that individually, as citizens of this great community, that we're doing our best to raise awareness about this critical epidemic that's happening not only here in our community, but across the nation. And we could put an end to it, and it starts here today. So thank you very much.
Thanks, Sarah.
Thank you.
Hey, good morning, everyone. I'm Chief Troy Fenner. I just wanted prepared some notes, but after hearing this victim, this powerful message of what we need to do, I just want to briefly speak from my heart. We need to listen to our victims. You walked through it, you went through it, and we need to hear. I got a lot of powerful, longtime friends here, but I met some new friends, very intelligent people. So here in Houston, Harris County, we need to do whatever we can. Sexual assault is one of the most underreported violent crime there is. And I'm sad to say, as a police chief, I can see why after hearing that. And I want us to do everything that we can do. I want to thank Houston Area Women's Center for what y'all do, the great leadership, and everybody. But I just want us all to come together as a community. I support this report and every recommendation in this report because it's going to make us better. And as the sheriff said, no excuses. Let's just get in and roll our sleeves and support these victims. We should not be victimizing them a second and third time. I want to thank everybody in HPD what they have done, our victim services division, and we learned from working with our advocates, and that's medical. All of those. We're one of a few major cities that has a victims assistance division. 36 advocates, and I'm so proud of them because you heard her. That's the uniform. That's love and their support. But we need people who are specially trained and to hold their hands and get them through not only that stressful day, but days and years to come. So we can be a community where people know if I'm sexually assaulted, if I'm victimized, this entire community, all of us, all of our systems and our processes will work together to seek justice, love, and support for them and their families. So I want to be brief, but I mean that from the bottom of my heart, and nothing is more moving when I hear from a victim. And I thank you so much for being here. Thank you so much. Thank y'all.
It is my distinct privilege to bring the DA up. We are so grateful you're here and for all of your work.
Emily, thank you so much. Thank you to every member of SART that's here. Thank you to many old friends. I'd like to recognize, as the Harris County District Attorney, the members of our team. We have a adult sexual assault division. It's led by Assistant District Attorney Tiffany Larson. She's supervised by Denise Onken, a familiar face to many in both mental health and in domestic violence and sexual assault prosecution. To the Houston Area Women's Center, this is great. This is the culmination, at least in my 36 years of service in criminal justice, of many, many people's desire to have a central one-stop shop for victims where they could reside if necessary, where they can get a respite if necessary, and where treatment and law enforcement come to them. You know, in no small part, my mother's own kidnapping by a serial rapist when I was a child, and her escape from that led to my desire to be the district attorney. The district attorney's office has always talked about the representation of people of the state of Texas, but my mother was a victim. You were a victim. In a sense, they are the consumers. They're the end users of all of our governmental and private services that have joined together in a response to stop sexual assault. When we don't serve our consumer because there are delays, justice is denied those crime victims. Now, when my mother was victimized, there were no victims advocates. There was no Houston Area Women's Center that reached out. There were very few services. She dealt with policemen, a nurse, and she went back to work that week. That's what people did. But the system did her kidnapper and the rapist of 2 other women in the same episode accountable, and they did so timely. What you see in this report, which is clear, is that there is delay at every single level. We have 4,000 reports. You'll see a smaller number of investigations completed, many pending. You'll see lab reports and lab statistics that show much evidence awaits testing. You'll see at the district attorney's office huge backlog of pending cases with few final resolutions for crime victims. This re-traumatizes people. So when I came to the DA's office, my goal was to have a victim-centric system. And I share that goal with all of these friends and co-workers. And I do want to thank Senator Jane Nelson for bringing this legislation, because it forces government to look at our results. Now, delay is not fatal to the system because it's correctable. More people to investigate sexual assault crimes will clearly make the system of interviewing victims go faster. More sexual assault nurses trained in that field will assist in processing the gathering of evidence more effectively. Our labs have backlogs. They need attention. We've been sounding the alarm because prosecutors and defense lawyers have to provide that evidence to the accused person prior to any case resolution. Many of these cases carry 5 to life or 2 to 20. Not many rapists want to sign up for that kind of responsibility. We move these cases in our courthouse through our system by getting them ready for trial and going to trial. And so to do that, we need the evidence timely. The investigators need it. The lawyers need it. And the judges must set these cases for trial. So we see great promise in this report because with this magnificent center, with the will that all of us who've worked in this system for many years share in terms of our desire to help crime victims, the end user of our justice system, we know we can do better. Solutions exist. We need to get the labs funded. We need to get the evidence outsourced when necessary. We need these cases brought to trial without delay. And we need our victims to know, just like Commissioner Garcia said, that we don't just say we have their back, that we really do. And now that we see the average time that it takes for a case to get through our system, we know how to fix it. It means resources. I'm often asking our government for additional resources because at the end of the day, victims are what public safety is all about. We're trying to prevent more, and we're trying to get you justice in a timely way because justice delayed doesn't serve anyone. I want to thank everyone here. I want to thank Emily for such a magnificent job and Sonia Corrales for leading this SART. This is a best practice. You're going to see an improved system because of it, and thank all of our partners.
Good morning. My name is Jamie Farrell, and I'm with Memorial Hermann Health System. And we are delighted to have the opportunity to be here with our Harris County community leadership and our partner agencies that are committed to improving process as we respond to adult sexual assault survivors who come forward to report that of the trauma that they've experienced and the role that we all have to that of potential trial. Thank you so much for your words this morning, grounding us as a group and a team to say her words and to understand her words. the trauma to trial is not easy. It's difficult. It's long. And for us to know how to support that and what it is that we are going to do. Finding the courage to seek help and report a sexual assault is difficult for any person who has been a victim of that traumatic event. I'm proud to say that at Memorial Hermann, we're committed to creating healthier communities now and for generations to come. And I hope to speak for all healthcare that is here, because we partner and we share that common goal for all of the patients that reach out to us and knock on our door. For Memorial Hermann, we have provided a specialized forensic nurse for over 30 years for patients that have presented at our doors. But knowing and understanding that unwavering commitment and dedication, the work that the forensic nurses do is in partnership with physicians, not independent of one of the other, so that collaboration of the team to prioritize the health, welfare, and the safety of the individuals who have suffered sexual violence. Our hospital facilities that we want those who've been sexually assaulted to come to are designated as safe ready, which means they are staffed with responding forensic nurses who champion trauma-informed, compassionate, and personalized high-quality care to address the physical, emotional, psychological, and the spiritual needs of those who've been sexually assaulted, both adults and children, while our SART is focused on that of the adult survivors. We want all who experience sexual assault to know to come. The health of patients is the #1 priority for forensic nurses in all of our organizations. We respect, though, that crucial need of the precision of the collection and preservation of evidence that is needed by our investigation and judicial partners, and that utmost importance of that need and that maintenance. When we care for adult survivors, we want them empowered to exercise what we call informed consent. They get to choose. Do they want law enforcement called and to have them engaged? They get to choose. Are they ready to have an advocate be with them and have one more person in their circle? Or do they want to remain in solitude in this moment? They get to choose their health care plan and what evidence is collected or declined. It is about letting them pave their journey, and we respect those decisions as it moves forward. When someone has experienced sexual violence, we ask them to be brave, not be afraid, and to come to the hospital immediately. We'll start by believing. We'll take the best possible care of them, and this will also provide not only the best health outcome, which they will need for the rest of their life, but also the best evidence preservation that they will need if they choose the judicial path. Our Harris County SART members want the community and sexual assault victims to know no one has to suffer in silence. Please come forward. No one has the right to sexually assault you, ever, in any circumstance, for any reason. Please come to the hospital, receive evaluation with the utmost compassion and care. We as a SART encourage you to just reach out. Take that first step, and sometimes that is the hardest. At Memorial Hermann, we respect and honor the courage of every sexual assault survivor. And for those men, women, and children who we will care for today, tomorrow, and in the future, it's our deepest privilege to provide you that non-judgmental, compassionate care. And we all commit to light the way to hope and healing for every survivor's life that our SART gets to touch. Thank you so much, Emily, Sonia, the work that this entire team has done, and being a representative with that team.
Hello, everybody. My name is Rose Luna, and I'm the CEO of the Texas Association Against Sexual Assault. We are a statewide coalition committed to ending sexual violence in our great state of Texas. We are housed out of Austin. We represent the whole state. We are the organization that crafted SB 476 and shopped it over to then Senator Jay Nelson, who then championed that through the legislative process in the 87th Texas legislature, which received unanimous bipartisan support. So I think the good news here is that we have folks in Austin, elected officials from all pockets of the state that supported this effort. But I did want to say and congratulate and thank the folks here in Harris County and Houston, because you all didn't need a law to start this. You all were already collaborating and trying to figure out how can we best serve survivors. I think what the law did is it helped provide some structure, and you all have taken that and really made this into what it is today. So it is really heartening for me to be here. First of all, when the law passed, I about fell out. I was very excited. I knew that it would be really, really helpful across the state. But not only did you all inspire us in writing that, crafting that, and shipping that around and testifying and talking about that, because we like the spirit of what you all had going on here, and we wanted that across the state. There was other pockets that were doing that as well, but you all are to be congratulated because you didn't need a law to start that, and I appreciate and congratulate you all in filling those requirements with being the report. And with that report, I've heard you all say that there's some that it's not the rosiest of pictures, and that's okay. I think what to celebrate today is the fact that you all are facing that data and you are committing to improving the systems and the gaps, and led by survivors like we heard today. I'd love to hear them, and I love that you all invited them to be up front and center, because that is who needs to be leading this charge. That is who should be informing all of us, even us that do the change, that try to do legislative change. We want to listen to survivors and have them let us know their experience and how we can make this better. I also wanted to uplift all sexual assault survivors and advocates. Hawk is the largest, not only in this area, but they're the largest in the state. And we also have other sexual assault programs in Harris County. So you all are so unique, and that you're so large, and you have such a collaboration with different rape crisis centers. But the sexual assault advocates, as the survivor mentioned that, did you know that you could have a sexual assault advocate with you every step of the way, and that she didn't. And it's sad to say that there's a lot that do not. So I appreciate the partnership between sexual assault advocates and our SANE nurses in introducing the sexual advocate from the beginning, building rapport. It's their victim right to have an advocate if they choose in the medical room. And so we appreciate that is happening here in Houston. And again, congratulations, and thank you all for having me. And thank you all for the leadership in this area. You are truly leading the state in this way. So thank you so much.
I am feeling very hopeful right now, because this is going a little long, and that you're still standing here shows that you have the resolve that it's going to take for us to address these systemic gaps. I am confident in the next couple of years, this building will be completed. The press conference will likely be inside. We will be reporting great progress, and I know that because you have been willing so far to stand here with us this morning. And we just have a couple of more speakers, and I am so grateful that we are represented well today, and look forward to having Sonia speak in Spanish and then a Spanish-speaking survivor, and then we will open it up for questions. So stay in there, hang in there, keep your listening ears open. We really appreciate you being here.
buenos días. English to Spanish. Creo que antes de decir mis palabras, que quisiera que Eva venga y... Hola, Eva. Hola. Eva nos va a decir su historia, nos va a compartir la historia de ella. Sabemos que en este equipo que tenemos las voces de las sobrevivientes es muy, muy importante. Entonces es una guía para nosotros. Pero quisiera, porque estamos demorando un poquito, entonces voy a dejarla que hable primero.
Buenos días a todos. Mi nombre es Eva Ortiz. Soy sobreviviente de un abuso sexual, el cual reporté a la policía de Houston. Reportar este crimen no fue fácil porque me sentí realmente impotente, vulnerable, humillada y lastimada. Quisiera compartir mi experiencia con ustedes. Cuando llegué a hacer el reporte a la policía, el oficial me pidió que fuera puntual, precisa y exacta en cuanto al acto de abuso sexual, sin extenderme en las circunstancias. Usé el traductor en mi teléfono para expresar lo que había ocurrido, porque no hablo inglés muy bien y en la policía nadie hablaba español. Tuve la impresión que no le importaba cómo yo me sentía en ese momento. Mi angustia, mi dolor, simplemente había que registrar la información en la computadora y continuar con el siguiente paso. Esta experiencia fue fría y mecanizada. Yo estaba desolada, asustada y frustrada por lo que me había sucedido. Porque simplemente sentí ser un número más en las estadísticas. Después de haber hecho la denuncia, me pidieron que fuera a un hospital a hacerme una revisión por el asalto sexual. En el hospital esperé por 3 horas o más. Cuando el médico me recibió y escuchó que estaba ahí por un asalto sexual, rápidamente fue por 2 médicos más. Así 3 médicos hombres frente a mí me observaron, esperando escuchar mi relato. Yo le había dicho al doctor que tenía mucha sed y hambre porque había pasado prácticamente todo el día sin comer ni tomar agua. Ellos me dijeron que yo podía ir comentando lo que me había ocurrido mientras me llevaban algo de tomar. Me sentí peor, más humillada y frustrada. Era como si se tratara de una visita de rutina, no de algo realmente grave. Me sentí tan impotente, lo que me había pasado no era un cuento ni una broma. Yo quería gritar y decirles que algo realmente malo me había ocurrido. Sentí que minimizaron mi experiencia y mi dolor. Estaba frente a 3 hombres, médicos, pero finalmente extraños para mí. Cuando empecé a llorar y a gritar que me habían violado, fue cuando sentí que ellos realmente creyeron que yo era una víctima. Finalmente me tomaron en serio y llamaron a la enfermera forense. Fui al hospital sin saber que tendría que esperar por largas horas. Pensé que por ser una víctima de un acto tan despreciable, me atenderían de inmediato y que comprenderían cómo yo me sentía. La enfermera forense, quien realizó la revisión médica, fue muy amable y empática conmigo. Después de que me realizara la revisión médica, llegó una representante del Centro de Mujeres. Ella me ofreció ayuda en todo, me abrazó y me dijo que ella estaba ahí para apoyarme. Tanto la enfermera forense como la consejera me trataron con empatía. Sentí mucha humanidad en su trato, que me comprendían, que me entendían por ser mujeres como yo. El rol de la consejera que fue al hospital fue muy importante en mi proceso. Llevó un poco de paz en el caos que sentía. En ese momento, sentirme apoyada y recibir un abrazo fraternal me dio la sensación que alguien realmente estaba salvando mi vida. Me hubiera gustado tener acompañamiento del Centro de Mujeres desde el principio y que una consejera hubiera estado conmigo desde el momento que fui a la policía. 2 obstáculos que pasé fueron el idioma y que me atendieron hombres, ya que en ese momento me sentía atemorizada, sobre todo por el sexo masculino. Algunas cosas que yo considero que el sistema necesita mejorar es la parte humana, sensible y empática. El rol de víctima es un rol que nunca más en mi vida quisiera volver a interpretar, pero lo viví. Fue para mí muy, muy difícil hacer la denuncia. Implicó sacar fuerzas de donde no las tenía, porque yo me sentía en el piso derrotada, humillada, frustrada y lastimada en lo más profundo de mi ser. Haber recibido un poco más de empatía, comprensión, palabras de apoyo o incluso una mirada compasiva hubiera hecho un poco menos difícil la experiencia. Un abuso sexual te amputa una parte del alma y aún así se puede llegar a vivir una vida plena. Para cada persona, el primer paso puede ser diferente. Para mí, hacer la denuncia fue el primer paso en mi proceso de sanación. Me gustaría que aquellas personas que pasan por una situación abominable como es el abuso sexual sepan que no están solas, que pueden retomar su vida y sentirse bien consigo mismas. Finalmente quiero agradecer a mi familia, amigos y consejeras por su ayuda en este difícil proceso. Han sido una luz en mi camino. A la policía de Houston y al sistema de salud de Harris, gracias.
Gracias, Eva. Muchas gracias por compartir tu historia. Sabe, una de las recomendaciones de este equipo es fortalecer el uso de las voces de las sobrevivientes, ya que estén parte del equipo o a través de decirnos la historia. Pero también vamos a seguir ciertos casos y a mirar qué es lo que está pasando con esos casos para poder mejorar el sistema. Pero como ya nos demoramos mucho, si uno de ustedes que de las noticias en español, si quieren una entrevista después, yo estoy disponible para hacer esta entrevista. Right now, we're going to go ahead and open it up for questions as we're a little delayed. But if you are a Spanish news media and would like an interview in Spanish, I'm happy to do it. And we have SART members who...
And maybe DA wants to come up as well. First thing is underreported. We've heard firsthand from two victims, survivors, and I think the main thing we need to look at as a city, as a county, as a region, how can we make things better and more supportive, and as all of us have said, more victim-centric and trauma-informed. How can we do that? And we got a playbook here, and we need to run that play. We also need to make sure that we have proper investigations. Our DA, and I'm going to step to the side and let her finish up. She told us some of the roadblocks in getting these cases through our court system. So it's a whole comprehensive approach that you need to have, and we need to look at the system and everything very critically as a collective team. And that's all I have to say. Go ahead.
I'd like to call up Tiffany Larson, the chief of our division, because she has practical experience on hundreds of cases and can really speak definitively to the question.
Good morning, thank you. My name is Tiffany Larson, as Kim Og said, and I work as the chief of our adult sex crimes unit at the Harris County District Attorney's Office. To answer your question, it's very, very difficult to prosecute sexual assaults under the current laws that we have. Rose Luna with TASA, her team works very hard to pass better laws, but right now we have a statute that doesn't comprehend all the different forms of sexual assault that survivors encounter. And so I would say that chief among the reasons why it can be very difficult to prosecute these cases is that we just need better laws. We have some antiquated laws that need to be fixed, and we're working hard to do that, but we can do more. But right now, absolutely, without a doubt, it's the collaborative effort. We do a very good job, I think, of working with our law enforcement partners and really thinking critically about how to build the very best investigation and collect the very best evidence. But as Kim Og and many others have said here today, that takes time, and unfortunately we need more resources so that it doesn't take so long. But that is several of the different reasons why it can be very difficult from the time a survivor reports to the time we're really inside of a courtroom and actually looking at a resolution can take years.
And can I make a pitch here? What this shows us is that the solution is a math problem. We have backlogged rape kits, we have backlogged investigations, we have backlogged prosecutions, we have backlogged appeals. The answer to backlogs is more people, because the customers are people. Staff takes training and they take positions. And so we need to be appropriately staffed in law enforcement all the way to the top, through the courts. We work with these partners. There is not any group here that is to blame. In fact, everyone here really should be thanked. I'm very grateful that our community has these assets. We just need more. And anyone here, I think, would tell you that, from victims advocates to police officers to prosecutors to lab techs. It's a math problem, and we can solve it. Thanks.
Thank you.
All right.
Any other questions?
Good.
We're good. Chief says we're good. Thank you so much.
Spanish or English? Spanish. Okay. I have two. Okay. Do you want to do it together or separate? Together? Okay. Sonia, we have two in Spanish, so we'll do them together. So let's wait and combine them.
Bye-bye.
No, I don't want to be responsible for it and not have it.